First food responders grew out of an emergency response to the COVID pandemic. At 23ZIP, we were building a diversified network of hyper-local micro-enterprise home cook operations called MECOs in places like Riverside County. Our focus is on helping people eat better food. Our motto, home cooked food made with love by neighbors who care, can benefit all hungry humans. However, when the pandemic hit, Riverside County was faced with the challenge of feeding people like senior citizens and people who had been temporarily housed in hotels and motels under lockdown. Health and environmental professionals from Riverside, including Brett Casey, Gail Hoxter, Wayne Harris, and Andrea Morey, rose to these county-wide food insecurity challenges posed by COVID and its aftermath. This episode is a case study about Project Roomkey in Riverside County, California. It was the first real test of our first food responders model for feeding some of America's estimated 60 million hungry families with safe, healthy, locally sourced food.
So Gail, when March 2020 hit, can you kind of give me some of the challenges that public health was faced with?
You know, Brent, it was an experience. The food system kind of, I want to say, crashed.
Yes.
We had a lot of challenges. What happened was, all of a sudden, we were in a stay-at-home order, and so the grocery stores, if you remember, trying to go grocery shopping, they were empty. The shelves are empty, and people no longer, if they worked or were at school, they didn't have those meals available during the day. So home ended up being the source for food. So with that in place, between the empty stores, being at home, we saw families going to the food pantry or the food bank, where maybe they might have had 20 people a day, all of a sudden they have 200 people showing up for food, which they did not have the resources. We were in the emergency command center, and we were under mass care, and we were looking at how do we alleviate this strain on the food system, and that's one of the things that your team really was instrumental in helping us get food out. We had the health plans were helping getting food out. It was amazing, and out of that we had people that were put in hotels. Then they needed to be fed because they were under restriction with COVID. So that's where Project Roomkey came into place.
Tell us a little bit about how you helped respond to COVID and helping those low-income residents.
I got a call from Gail Hoxter, who is the director of the Nutrition Services branch. She asked me if I knew of a way to get meals to folks who were unsheltered, and they were going to temporarily shelter them, but they wanted to make sure that they provided a full continuum of care, which included providing meals to the temporarily sheltered individuals. So I went right to work. And so what we decided to do is pull together a vendor that could provide prepared meals, and we would do the delivery. So we got trucks, refrigerated trucks. We connected to this vendor. We'd pull up, load up the trucks that day in the morning, create our manifests, and head out with 3 different refrigerated trucks. Do you remember when we were delivering these meals and what it looked like and what it took? When we would pull up, we would drop the lift of the big refrigerated truck, and we'd have these huge racks. We put them on the back of the lift and bring them in there.
That's right. We had baker's racks
full of
those frozen meals, and I always thought, this is great to serve the need immediately.
Right.
But how are we getting a better nutritional value, a little more personal service, if you will, to the residents that we're trying to provide meals for?
We did that until the initial response was over. We did that for 3.5, nearly 4 months. And then because we were sort of getting into the recovery phase and we knew that this was much longer term, we couldn't sustain that effort. So we decided to go ahead and solicit a vendor to take this over. So what I was looking for in a vendor was some methodology to reduce the carbon footprint and still provide either the same quality or hopefully better food for our unsheltered, temporarily sheltered individuals in Project Roomkey. So what we ended up doing was contracting with 23ZIP. And 23ZIP was an innovative fresh look, a fresh sort of concept on how to provide food at a local level. We were keeping things locally produced and locally and sourced locally. So the raw material that went into these meals was all sourced locally. The production was local, and then the delivery was local. So we eliminated 2 or 3 steps in that supply chain that were massively carbon dependent. And so overall, we saved hundreds of thousands of cubic feet of carbon emissions just by going to a local food source and a local model of providing this food.
Being part of the first food responders family means becoming a trained and licensed home or commercial cook, ready to respond on demand to any emergency in your own community. The pandemic created its own set of challenges, but next time it could be a fire, a hurricane, a chemical spill, or even a local plant closing, and unemployment that requires the help of first food responders. While on the mission to help people eat better food, you will also be creating change through food, improving public health, providing food security, and bolstering the resilience of your own community.